You know by now that this new approach to psychotherapeutic diagnosis is called Interactional Pattern Analysis, the IPA. But what will the IPA enable you to do as a therapist that goes well beyond conventional psychiatric diagnosis? Welcome to The Art of Therapy, Season 2, Episode 22.
I'm very excited to be back here with you today and just really further exploring the art of therapy with you.
Share that. We've come a long way.
We really have, yes. Let's just to take a step back, just to recap where we left off the last time. So the last time we really had a look that the IPA is really a truly an integrative approach where it's adding lenses to each other, which creates a different picture from just using one lens at a time. So really working integratively.
Yes.
And then the second part as well is that it really becomes a relational diagnostic tool for psychotherapists. And I think that's very exciting.
Yes. What you've noted are two really important parts, that it's an integration of different theoretical or therapeutic approaches, and then that it's a truly relational diagnostic system, that it is truly interactional, which makes for a very exciting approach to psychotherapy.
Yes. So just the last time we said that all therapists, we are trained in the DSM, and just thinking about how do the DSM and the IPA, how do they relate, and how do therapists just use them together?
I think this is so important what you've asked, because one can only utilize a frame of reference and understand diagnostic approaches if we can understand their relationship and what are the benefits, and so this is really important. The DSM, which is in its 5th revision, so DSM, the Diagnostic and Statistical Manual of Mental Disorders, effectively version 5, is a really well-developed approach and a diagnostic approach to understanding or trying to understand mental difficulties. It originated in the field of primary health care, a specialist area, psychiatry, and it's part of the medical model where within the medical model, one examines or studies, notes symptoms, then looks for a group or constellation of symptoms that is thought to be related to a particular disorder or disease of the individual, and then some organic process that's underlying the pathology or problem. That's how the medical model works. And so DSM very similarly really looks towards a constellation of symptoms of distress for the individual. And when they form in a particular way, or group or constellation, considering this may be part of some disorder and some condition that the individual is experiencing. So if the individual presents with very low mood and feels very hopeless, for instance, doesn't see any sort of self-worth or experience any worth, struggling to sleep, as someone starts expressing this, and there are a number of symptoms, this would be moving towards the diagnosis of depression. There would need to be more, but it's based on the idea that there's a depression condition or disorder that is very often biologically driven in the individual. And so it's a reductionistic model, and it always reduces it to the individual and very often to some area of organic or biological functioning. So it's an exceptional model. It's a remarkable model, and that's why in healthcare there's been such advances. And then the contribution of DSM in mental health has been so, yeah, remarkable. There's been many people helped.
Mm.
So that is a conventional diagnostic system, and psychologists effectively borrow that diagnostic system, as is anybody in mental health care, be it a general practitioner, a psychiatric nurse, some areas of occupational therapy, but of course the primary or core speciality that we'll draw on it today is the field of psychology, psychotherapy.
It really is. There's so much ground that was broken with that, and really offering a lot of support for mental health and understanding it
Yes.
and trying to make sense of it. And then also with that, it's a communication tool for practitioners or therapists to understand what's going on and what's happening. So that's really understanding, and created a lot of assistance in assisting with improving mental health and understanding mental health.
Very much. I think what you said is so important, that it's also a part of communication and a communication device for many patients or clients, when they can understand that they have, for instance, a phobic reaction, and this is how phobia works. That can be really helpful. Someone who's clinically depressed hasn't recognized that they're depressed, and if a therapist sensitively and in a caring way will communicate a possible diagnosis, that can be really helpful. Or ADHD, attention deficit hyperactivity disorder, one can just be relating in ways where one's distracted, impulsive, struggling with attention, concentration, procrastinating, and just living like this without actually realizing perhaps there's something to this pattern of difficulties. And the moment one receives accurate feedback can be so helpful. Trauma the same. So yes, it offers great assistance to clients and patients in the therapy process when something meaningful like this can be communicated.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za. It's really meaningful and really brings a great deal of assistance.
Yes.
So if we move the focus to the IPA or the relational diagnosis, how do they fit together?
Right. So the DSM, or more conventional approach, as I just noted earlier, really reduces the problem to something in the individual, and very often something organic. And again, that has its place because it's part of a frame of reference. Where the IPA offers really a quite a different look at what the individual is experiencing, is that it looks at the problem in terms of the individual's behavior, their communication, and their primary system. So it doesn't locate it in an individual. It locates the potential difficulty in the relationship. There's something about their interaction, their communication, that is causing distress to one or both of the people involved. But it can be more than that. It can be a family that's in distress. And so it becomes this remarkable lens to start seeing what's happening and how we're relating that's affecting both of us, or the entire system or family. And it's something that can be observed. One can see it as a therapist. So it's very exciting that the moment you start to understand difficulty or pathology from a relational perspective that isn't always or only located in an individual, which is helpful, but this is an alternative lens to start seeing what's occurring in the relationship or relationships. And that opens up a whole new world.
It really, it's like you explained, it opens up a whole new world. It's not either or, it's
Yes.
understanding there's a place for both, and having understanding of both. Just actually, it brings such a bigger picture, actually.
It
And
does,
it gives
yes.
more room for a therapist to work. It's working inside with the positioning it as an individual, but also having a look at the environment, the relationship, and you can work there as well.
Very much. You were saying earlier about an integrative approach that draws effectively on different lenses. And as a psychotherapist, to be able to have both lenses here for diagnosis, DSM, and then being able to look at the relationships, the system, the family, the couple, that's really exciting because it fills out and expands what the psychotherapist can see, and moreover, how they can help.
Yes, I just want to say it's actually there's really a lot of empowerment for therapists in adding a frame of reference, because it just gives you more room to understand, to see, to work, and to help.
Yes, yes, very much. Because part of the beauty of it is as we begin to look at relationships and communication, not only can we see it, observe it, so pathology becomes visible, difficulty becomes visible, and it can be described. And two or more therapists can have a look and see the same relational difficulty, the same pattern of interaction, the same communication, and predict on that basis whether that's going to help mental well-being or it's going to take away from it, and does it relate to the presenting problem. So it becomes visible, which is really exciting. It's so practical. And there's another quality about this, and that is that working systemically, that I've expressed before, that all changes now. And the reason for that is because of circular causality. I'm affecting and impacting on you, impacting on me, impacting you. So we're mutually affecting one another in how we relate, how we feel, what we experience. So that means that any difficulties we've had in the past, if they remain difficulties, are somehow here in the present and may very well be evident in our interaction. And the more we interact, and the more there's something similar or some aspect of our communication or behavior that relates to an experience many years ago, the more visible it becomes. So we get to work and look at things in real time as it's happening, which is an incredible challenge and opportunity for the therapist to consider. Yes, there's been something in the there and then that was potentially traumatic. But how is that occurring? How is that visible now? And how is it that someone is relating or interacting that carries with that the elements of that trauma, be it unsaid or that the individual doesn't even know about, but it's actually evident in the way they are relating, or a system is relating.
Yo, I think that's just beautiful. It brings it into the here and now, which means that you really actively work in the here and now.
Yes.
And that becomes extremely powerful because it makes it tangible, it makes it doable, whether it's something that happened in the past that affects this, but it is how it is seen in the here and how it affects the here and now. And that's where the power is, because we
Yes.
live in the here and now.
Indeed. And that's what's really exciting for therapists. Once they start to consider and start to learn the IPA and a relational interactional frame reference, psychotherapy become so visible and what it is they need to do. Because I think, as we've noted before, psychotherapy and trying to help others is a profound, it's something profound, and it's deeply meaningful, fulfilling work and role. But it is also very abstract, and for therapists, it can be very, very confusing. It can be frustrating because they so much want to help the other, but what do they pay attention to? And what aspects of the past, what aspects of the present? And the IPA makes it very, very practical, very tangible, bringing change into the now. And being able to look at this at the level of how we're relating our relationship. And because we're communicating all the time and behaving, we can change that. We're not limited to only something that occurred many, many years ago and limited by that. Also, we're not just exclusively defined by, not everything is just something organic that can't be fixed. That's some aspect of our physiology that's beyond us. No, we can behave, we can communicate in new ways, especially if we've got feedback and we understand how come. So, yeah, therapy and psychotherapy becomes such an exciting process, very practical.
That is exciting because it's practical, it's empowering.
Yes.
So I think just what a question then with that, on the practical side, is how do you do an IPA? So having know a lot of the details, a lot of the information around it. Question is how?
Yes, I'm aware that you don't let go of the how, and we're back to business. How does one do it? So let's explore that in an upcoming episode.
Okay, looking forward to that.
Yes.
Thank you for joining us on the Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.